Hello everyone. We are going to have a talk on the mental health, especially in the pandemic. So we are going to stress upon the impact of stress on the mental health and in the pandemic situation. Well, there has been a huge concern in a lot of different population, and especially when we talk about adults, we have always known that stress is impacting adults. But we are going to talk about two more different population today, which could be surprisingly children. Lately, there has been a lot of parents who are bringing their children for a lot of different aspects. So we will address them. It is really surprising to know that children who are even toddlers or children who are even preschoolers have been affected. Now, why is this happening in children is pre-COVID days, people used to take their children outside to their neighborhood, or relatives would attend their families, or people would meet a lot of different people. But in the pandemic, because of the lockdown, children have been kept at home, so there is a lack of cognitive stimulations. Children are not able to play with other children, not able to spend time. So there is a lot of cognitive impairment, or there is a lot of sensory deprivation, or the lack of sensory stimulations happening in children. Like children learn from facial expression, from the auditory expression. They learn a lot from the surroundings. But because of the lockdown, there is a lot of cognitive impairments happening in children, is the first aspect. There is also lack of language development. So you see, preschoolers, that is the toddlers, have been really impacted by the pandemic, and that is the biggest concern. And when we talk about the school-going children, maybe pre-adolescent children, that is children from the age of maybe 3 or 4 till the age of 8 or 9, have been affected with aggression, violence. So a lot of parents have been telling that their children are showing tantrums. They don't eat food, they don't want to attend classes, they don't listen to them, they don't obey their instructions. So a lot of children are showing tantrums, aggression especially. Now talking about the adolescents, people between the age of 11 and 12 till the age of 18 and 19, various different issues. From the mobile addiction, gaming addiction, Facebook addiction, that is the social media addiction, or people who are binge watching a lot of episodes in web series or movies, is the biggest thing that is going on in the adolescent age children. And also having difficulties in the school, in the college is also another aspect. Now, along with all of this, students, especially in the final years, either undergraduation or post-graduation, are also going through issues, especially existential crisis. That is, having a huge question of what next? What do I do next year? Should I go to work? Should I go to further education? And also there is a new concept of imposter syndrome. Imposter syndrome is where a lot of students are developing this fake qualities. Am I a good profession? Am I a good professional? Because I have passed out during the lockdown period where I don't have an exposure. So imposter syndrome is where students are developing a fake quality or doubting on themselves, the self-doubts about their professional qualities. Yeah. Now, apart from the children and the adolescent, the next biggest population is adult population. Women, especially the housewife, have been really hit with a lot of stress. That is, women usually used to have a lot of free period after sending their husband and children to school. But now, after husband going to work and children going to school, women are not free. Earlier they used to watch TV, they used to relax, but now their work has extended. They have to cook a lot, they have to work a lot, they have to take care of their children's assignments and take care of their education because everything is online. And also there is a lot of domestic violence, marital discord. There is definitely a lot of differences that is happening between husband and wife because they both are at home now. So the differences are increasing. They're all talking about their issues and it is becoming more. So the relationship issues is one of the main factor, the marital discrepancies. Marital conflict is what I have been really seeing in the clinical presentations these days. And when it comes to working women, definitely there is even more added stress because they have to take care of the work, they have to take care of the home settings. So the work has definitely given a huge challenge work from home setting. When it comes to men, definitely there's a lot of substance abuse that is reported. To tackle with the stress, men are involving into substance, that is alcohol and cigarettes, and there is a lot of sexual dysfunctions also that is being reported because of the stress. And anxiety, insomnia, that is the sleep disturbance, and depression, and all along with the substance has been the main mental health concerns that is being seen in the adult population. Never to forget the geriatric population, elderly people. They are really going through a lot of anxieties about developing comorbidity, if they have diabetes or hypertension, and what if they develop any other problem. And especially people with the COVID positive have developed a lot of anxiety. Some even develop panic disorder. So there has been a lot of people who even came to me for concerns of suicide, because they felt that life has become really strugglesome. There is a financial constraint, people are unemployed, there's a lot of issues in the family. So if you see, the mental health concerns spectrum has really broadened from the times of pre-COVID. So post-COVID, there's a huge concern in every different population, different gender, people with different professions. So always trying to understand oneself, developing insight of what are the different concerns, and if need be, definitely reaching out to a mental health professional, even reaching out to a general physician is definitely a useful thing. There's a stigma still attached of reaching out to a mental health professional. Still, reaching out to a general physician is also a good idea, because a general physician still can help you reach out to a psychologist, psychiatrist, or need be, they can still help you out with whatever they can. Thank you.